guest host, Magda Soto. It's very challenging to have a child with attention deficit hyperactivity disorder, and parents need all the help they can get. Today we have Dr. George Nodarse, Clinical Director of the Child Study Center, Bronx Lebanon Hospital, to help us better understand and guide us to proper treatment. Welcome to the show, Dr. Nodarse.
Thank you for inviting me to your show.
You're welcome. Dr. Nodarse, what is ADHD?
Well, basically kids show ADHD in three different ways. We have some kids that are very inattentive, they don't follow direction. They're the kids that kind of sit in the classroom and the teacher has to tell them things multiple times. And this goes on day after day in the classroom. And when they're given tasks, they forget as quickly as they were given the task. They forget that they were supposed to do that.
So there's different types, right? What are the different types?
Different types. Well, you have those kids that are very inattentive. Then you have a second category of kids that are very hyperactive. And then you have a third category of kids that have a combination of both, that have the inattention and the hyperactivity. So
How can we tell? What are the symptoms?
Well, for example, the kids that are hyperactive are going to be moving about a lot. Some of them will actually pick up and leave the classroom because they really cannot contain themselves in one room. And the fear of that is that they can actually leave the classroom and leave the building altogether. And you have 5- and 6-year-olds doing this with ADHD. So as you can imagine, it's a very dangerous situation for the school teachers. Also, with the smaller kids that are hyperactive, they tend to, there's a certain percentage of them that develop a positional defiant disorder. It's almost 50%. And those kids tend to then be aggressive with other kids. And so we have to be careful with those other kids because you have to kind of protect them.
So what are the statistics for ADHD?
Well, in the U.S., you have anywhere between, for the school-age kids in grammar school, is anywhere between 15 to 12% a year are diagnosed with ADHD.
Are there many going undiagnosed?
Many are going undiagnosed because what happens is that parents are not really taking them to places where they are given battery of tests, where they're taking the clinical history, and the teachers are not giving enough input to say, this is happening in my classroom. So yes, today many kids do go undiagnosed, and the pity of that is that these kids will fall by the wayside. Academically, they will not be able to pass their grades. Eventually, they will end up in special ed instead of being able to continue in regular ed. So it is unfortunate.
Can you tell me a little bit of what the Child Study Center is doing for these kids?
Well, basically, when someone brings a patient to the Child Study Center, we go through a screening process. And there, initially, they see a clinical psychologist or a licensed clinical social worker who's going to do a screening forms to pinpoint ADHD in two settings. So it has to be either in the home or in the school environment or outside of that setting. The kid should have really the symptoms minimum for at least 6 months. So that's going to be the first step. We're also going to be sending questionnaires back to the school. The second step is actually a child psychiatrist who will further assess the child now that we have all the screening tests back and that we have some evaluation reports from the first 2 staff members who saw the child. After we gather all of that information, we have a team meeting, we discuss about the specific case, and we think, maybe this could be ADHD. And we call the parents in to have a discussion. And that discussion could mean that we may actually tell the parent at this point in time, your child would really benefit for, let's say, behavioral therapy by itself. So why don't we try a trial of that? Or in other cases, where cases are more severe, we may actually say, we're going to start behavioral therapy, but we need to consider medications along the way.
What are the medications?
There are many different medications out in the market, such as Concerta, Adderall, Focalin, Ritalin, many, Strattera, and we really take each one and titrate it to the needs of the child. Each one has different side effect profile. So you really have to know the kid, and then based on that, it's that you're going to look at the weight of the child, and you're going to begin at the lowest dosage, no matter which medication you began with.
Are they addictive, or do the children experience side effects if the meds are stopped?
I haven't seen the kids experiencing side effects when the meds had stopped in terms of addiction. What I have seen, and I have seen this over and over repeatedly, is that when the medications are stopped, kids whose self-esteems are really high because now they had really good grades, as the meds are stopped, those grades begin to really decline.
How
And,
exactly
you know,
do the meds work? What are they designed to do?
well, what they're designed to do is they're designed to increase concentration and hold on to memory engrams more. Because in order to learn, the mind has to be able to hold on to information, be able to process it, and then when the kid takes the test, to be able to put that down what they remember. One of the problems within attention is that all those steps don't happen. So information kind of goes in one ear and out the other.
I see.
Yeah, so the kid is not able to hold it, and when the test comes around, they do extremely poor in terms of grades.
Is there any specific test to diagnose ADHD?
Well, actually, the diagnosis of ADHD is clinical, and we use the DSM-4-TR, which is the Statistical Diagnostic Manual of Mental Disorders, and it's very clear if you have this many from this column and this many from this column, you're an attentive type, and this many and this many, you're a hyperactive type, and then this other combination, you're a combination type. So it's very cookbook when it comes to that.
Is it possible, how many people are going undiagnosed with, how many children are going undiagnosed with ADHD?
I don't really think that there are statistics on that because, you know, these are parents that are holding on to their kids hoping, you know, there are certain fantasies that parents hold on to that this will kind of go away. If I wait long enough, my child will get over this, or they think, oh, my child is just not cooperating and they just don't want to do well in school, or they want to upset me. You know, so once the parents are able to overcome that and realize that this illness is very much like asthma or diabetes, that it is a medical illness and that it is treatable and it has good outcomes, I think that then those parents turn around and as a result, their children start to do better.
Is it possible to misdiagnose?
Well, what happens is that there are similar things that appear to look like ADHD. For example, bipolar disorder can look like ADHD, anxiety disorder, PTSD. However, those syndromes are so specific that very similar as we have very specific concrete criteria to diagnose ADHD, we have the same criteria for bipolar disorder, for anxiety disorder. So I'm not saying that it doesn't happen in cases, but it's very difficult.
Okay.
Yeah.
We're going to go on break and we'll be right back with Dr. Nodarse.